my name's James and today we're going to be talking to you about axial spondyloarthritis or ankylosing spondylitis, as some of us may know it by. Now, I'm currently involved in a quality improvement project to help clinicians within primary care detect patients with axial spondyloarthritis sooner and ensure that these patients are being referred promptly through to rheumatology. Now, for the rest of this video, we'll just use the terminology AxSpA, because it's just a bit easier than axial spondyloarthritis. And AxSpA is an inflammatory condition that mainly affects the spine and the sacroiliac joints. It's estimated to affect 1 in 200 adults here in the UK, and we predominantly thought it was a male condition, but now we know that women are equally affected. Now, there are certain features of AxSpA that separate it from our typical mechanical back pain, and that's really important that we're thinking of these questions when these patients are coming in to see us. So the first feature, typically the duration of symptoms. These patients will get episodes of back pain that last longer than 3 months, so that's really important to think of. Now, the ASAS have got an inflammatory back pain questionnaire, which you'll see on the screen now, which covers 5 questions, which is important to ask for these patients that are coming in. Now, first of all, age is quite an important feature. We know that AxSpA tends to affect the younger people, typically under the age of 40, and that average onset is roughly around the age of 26. So one of the first questions is, how old were you when you started getting this back pain? Secondly, these symptoms tend to come on quite gradually. There's no specific trauma or injury that brings on this pain, and they tend to report to be better when they're exercising and moving, because we know that exercise is a good anti-inflammatory. These patients tend to be worse when they're sitting, when they're resting, when they're immobile. And another feature of AxSpA is night pain, which is quite common. And these patients tend to report night pain that is enough to get them out of bed, to be walking around before they can go back down. And this typically affects them in the second half of the night, around 2-3 o'clock in the morning. So those are some of the 5 questions you may want to ask patients that are coming in with a younger onset of back pain under the age of 40 and there's been no clear incident. Now, there are other associated features that we'd expect to see in AxSpA as well, and they can be alternating buttock pain, just with where the sacroiliac joints sit. They respond really well to anti-inflammatories, so that's also something to really ask as well. And there are other features of inflammatory conditions that can increase our suspicion of AxSpA. And these are a history of psoriasis, any inflammatory bowel disease such as Crohn's or ulcerative colitis, and anterior uveitis. So it's really important to be thinking of those in the past medical history as well. Family history is also really important, so any first degree relatives that have had a history of AxSpA, there is a genetical link. Now, the reason we're doing this quality improvement project is at the moment there's a massive delay to diagnosis for these patients, and they're typically taking 6 to 8 years from onset of symptoms to when they're being finally diagnosed by a rheumatologist. And over this 6 to 8 years, it has a massive impact both on their physical health, also their mental health, coming out for appointments to see GPs or other primary healthcare clinicians. There's also a massive impact financially. It's estimated that these patients could be losing £193,000 over this 6 to 8 year period. And we also know that it has a massive impact on the UK economy, estimated about 18 billion per year for this delay to diagnosis. We also know if these patients are picked up early and are referred through to rheumatology, that treatments can be really good, and there's lots of treatments now for these types of patients with AxSpA, and the sooner they're started on them, the better their outcomes are, both short and long term. Now, you might be thinking, how am I going to be able to remember all these features and all these different questions, or any past medical history of all these different inflammatory conditions? And that's where we're coming in to try and help us within primary care, both GPs, FCPs, advanced nurse practitioners, and what we're trying to do is try and help improve our awareness of these patients. So one aspect of this quality improvement project is to set up a pop-up tool. Now we're looking just to pilot this within the Stockport East and South PCN. So if you work in that PCN, please look out for it and please use it. Now this pop-up tool will only pop up for patients aged between the age of 18 and 45 that have had an episode of back pain within the last 3 to 12 months. So it's really important that we code our patients with back pain, and this pop-up tool could pop up if that patient comes in. Now there is an option of closing it if it's a second episode and there's been a mechanical nature, that's fine. But if someone keeps coming back, then think, could this be SpA? And this pop-up tool will pull up information, so it saves us time. It will look for any inflammatory conditions such as our psoriasis, our uveitis, or any diagnosis of inflammatory bowel disease. It will pull up if any bloods have been done, looking for CRP, or if any other genetical blood tests have been done, like our HLA-B27. And it will pull up that ASAS inflammatory back pain questionnaire that we can ask the patients there and then. We're also in discussions with rheumatology, so they're really keen and on board to help us in primary care. And we're looking at setting up an inflammatory back pain pathway, a little bit like the early inflammatory arthritis pathway that you might see recently. And if you have any patients that you're not quite sure about, then they're more than happy for us to use that advice and guidance service. We're also trying to look at some educational training to try and improve our knowledge of these patients as well. So just to summarise, think of those patients that come in with back pain, younger patients that have come on maybe with a gradual onset, that seem to be better when they're moving, worse with rest. Ask them about night pain, ask them about any other clinical signs and symptoms that could increase your suspicion, and think, could this be SpA? Thanks for listening.